is Tuesday, which means we're joined by somebody from Greenwood Leflore Hospital. This morning, Mr. John Cook, who's the Director of Rehab and Wellness Services. Welcome, Mr. John.
No, thank you. Glad
How
to
you
be
doing
here.
this morning?
Great, so far.
We're glad you're here this morning. April is Occupational Therapy Month.
Correct.
You are with the Rehab and Wellness Service. Talk to me about occupational therapy from the aspect of, rehab and things that people who go through this are going to deal with.
Well, I mean, occupational therapy, of course, is another form of therapy that we offer there at the center. And it's a more specialized, I guess, component of therapy where they deal with upper extremities. They deal with ADLs, which is activities of daily living. They kind of return people back to that lifestyle, if they've had an injury or disability. Some people maybe have an amputation or something to that effect, and they kind of retrain them to get back into some normal lifestyles and be able to adapt to some normal activities of life.
And being the Director of Rehab and Wellness Services over at Greenwood Leflore, what kind of patients do you see? Because occupational therapy is one thing.
Right.
But what kind of other patients do you see there?
We see a range from pediatrics, which is babies, infants, of that nature, and then all the way up to geriatrics. We've had some up to 99 years old.
Wow.
So, and they range from car wrecks to disabilities to strokes, CVAs, a lot of different types of patients that come in.
So many types of people that you work with. Let me ask you just about the rehab process. When somebody goes through an injury, is there a time limit that rehab takes for a person, or is every bit of it individual?
It varies, on the individual and what type of injury it is. It just depends. If they've had something where on the acute stage where they actually have been in the hospital, we do therapy at the hospital as well too. We might go in that day and start, working with, just some basic things of trying to get them to be able to, button their shirt or learn how to comb the hair again, those type of things. Some basic things that we take for granted. Right. People have to kind of retrain and relearn how to do those things. And that's what occupational therapy kind of deals with, is trying to get back into being able to do those daily activities that, we might take for granted on a day-to-day basis. But once they progress on into the outpatient area, then they can do a little bit more upper level type of activities. And
it's all progressive.
Correct.
Throughout the thing.
That's right.
Let me ask you this. If somebody has had an injury, maybe they're not at Greenwood Leflore right now, if somebody has had an injury or needs the rehab process and they haven't been with you guys, is there something they can call you guys and have you walk them through that? And if so, how do they contact you?
Well, first they have to have a doctor's order. Once they get the doctor's order, they can come to our facility. We can get them set up. We'll call their insurances and get pre-authorization and all those type of things that have to be done. But once they get that established, then we can start seeing them, and it can vary just depending on what the disability or what their injury is, as far as how long they would be there.
And let me add this, one of the last things I want to ask this morning. When we talk about rehab, obviously you've kind of covered it. It's a lot of different issues.
That's right.
What about something like cardiac rehab?
Yeah.
How do you guys go about that?
Well, that's the same case. We have to have a doctor's order, for us to do anything from that nature. But, in the cardiac area, we do, patients that might have had cardiovascular accident or MI, or maybe just had diagnosed with CHF. They can come in and we start treating them on our daily routine, where we start exercising them and monitoring their heart rate and heart rhythm, and just kind of progressing them, through normal activities of exercise and different intensity from that level.
It's such a broad field.
Yeah,
There's so many different things to do. So glad that you guys offer so much.
Yeah,
if folks want more information about you guys, how do they get that?
Right. Well, the best place is to look at our website, glh.org, O-R-G, and they can look at that, get a lot of information about the cardiac unit and also about the occupational therapy. And they can also give us a call at 459-2655, and we'd be glad to work out whatever we need to, get them set up an appointments and those type of things.
Fantastic. Thanks so much for being here
Appreciate
this morning.
you.
It's all about your health with Greenwood Leflore Hospital. We want to thank Mr. John Cook for being here this morning. And be sure, if you'd like more information, glh.org. Stay with us. Coming up after the break, we've got more Good Morning Mississippi. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.